First, I'd like to take a moment to wish a very happy new year to our community members who are of Sri Lankan, Thai, Cambodian, Bangladeshi, Myanmar, Indian, and Nepali descent, and who practice those cultures. For many of you, that day is tomorrow. I know for India, part of that was last month, approximately the 25th of March, with others celebrating now, depending on what your relationships are and who you affiliate with. And a very belated Happy Easter and Passover to our community members who celebrate those holidays and did so this past weekend. I certainly hope these traditions and celebrations provide a bright ray of light and a sense of ease to our community during these times of uncertainty and for shelter in place. I have just a few updates for the community this week. First, many of you are aware that we did have a COVID-19 positive student on our campus, one of our pharmacy students. My understanding is that she's doing very well at this point, although had been pretty markedly symptomatic, and was evaluated at one of our local community hospitals. They felt she was safe to be home, and both our team as well as the Department of Health have conducted frequent follow-ups to ensure that she's continuing to do well. Our fourth-year students, congratulations, you have about 12 days left. And very shortly, we'll be unleashing a brand new set of doctors and pharmacists and researchers out to practice their trade and to take care of our communities. For Ohio, we have about 80 of our medical school graduates and somewhere around 60 of our pharmacy graduates who will be here serving us, taking care of family members, friends, and potentially us during these difficult times. So a big congratulations to them. You're almost finished. On that note, we've made substantial progress on commencement. There's a web information about this. I want to thank Sandra Emmerich and Rod Ingram for all the work that they have done, meeting with our students, our student leaders, sending out and responding to surveys. We think we have an amazing plan in place that will help us celebrate this in a very meaningful fashion, despite the fact that we won't be able to do our traditional gathering. I've learned from Dr. Young, the Dean of our College of Medicine, that our activities have been one of 4 nationwide that is being highlighted as a successful way of innovatively celebrating commencement. So really outstanding job, and I applaud all of you for your efforts. NeoMed has answered the call for the crisis, helping our communities here locally. Just a few of those highlights. The KSU, Kent State University, and NeoMed came together in response to a request from our hospital leaders in the Canton-Akron area, put together a really outstanding plan to step up a 200 to 800 bed care facility on the NeoMed campus, on the Kent State campus, using NeoMed physicians, pharmacists, and students from all areas, along with Kent State Nursing and Allied Health. That plan has matured and has been written by our amazing fourth-year students who are currently taking our pandemics and ICU course. Part of their tasking was to put together a viable plan for getting this into place. The plan, as well as a site visit, was conducted by the Ohio National Guard, who thought this was an outstanding opportunity last week. We have heard from them since. They are considering another site visit. At this time, they think the plan is outstanding, but there's a high likelihood we will not need to implement it because our measures that have been implemented by the governor and our Department of Health have been so effective. The thoughts at this point are that those surge capabilities to deal with more patients than resources in our local hospitals are probably not going to be required. We will continue to have the plan ready to go, contracts maturing and getting into place so that NeoMed and KSU can step up to implement this on a moment's notice. We are asked to, but we're very fortunate that our measures seem to be working, and it's highly likely we will not need to do this. I do want to recognize that we've been highlighted also for helping out our local hospitals. Our researchers have come together and assisted with machines from our research laboratories, gotten those out to hospitals in Akron, Canton region who requested it from us, and are now helping to double or triple their capabilities around SARS-CoV-2, the virus that causes COVID-19 virus. And so great work, as well as supplying large amounts of PPE to our community. So thank you to all of you who stood that up for us. This doesn't count all the students and faculty and staff who are volunteering in a variety of different areas to help the communities, both here as well as in New York. We've had several students who've gone out to New York now to start helping out where the crisis is a little bit more in surge crisis mode, and others are being asked to step up and come in and assist. So I want to thank all of them for all the incredible work that they're doing. And in partnership with our new center team, we've been working on setting up food opportunities for those in need in our local community, as well as our emergency medical responders. The team from Signet and NeoMed have come together seeking and getting grants to be able to provide meals to those individuals, and we expect those efforts to step up quite shortly. We are continuing to monitor the state budget and the reductions that have been proposed for higher education. These have not been cemented at this time, and we are still working with the Inter-University Council, the Chancellor's Office, and the State General Assembly as we follow and look at what those potential impacts could mean for NeoMed, as well as other publicly funded universities. We're watching this evolve, and I have no new information to provide on that. I know I shared that information with you last week that we were expecting substantial cuts. We're hoping those are not going to come, at least at the level that initially were predicted, but we will follow and keep you updated as we learn. And I am setting up meetings with our chairs, our deans, our VPs, and our faculty members to have these discussions, ensuring that we are continuing to take care of our community, our faculty, and our staff here at the university so that we can continue to educate our students, become the healthcare workforce and the research scientists for our future. So please be patient as we wait for the state legislature and the governor's office to make these decisions with our input and our advocacy for keeping those at a reduced level. Ohio is continuing to flatten our curve. I think one of the struggles that we're really going to have at NeoMed and the struggles that we're going to have statewide is making the tough decisions as to when to return to work, how we sequence that return to work safely, what the criteria will be, who comes first, what type of testing might be required, what type of barriers might be required to use to prevent a resurgence of infection. And I don't think these answers are very well known at this point. They made the difficult decision to rapidly move to shelter in place, and in doing so, save lives, and in doing so, reduce the really big reduction in the capacity required at our hospitals to care for these patients. But the decision as to when to come back and what criteria to use, I think that's going to be a much more difficult decision for us to make. And we are waiting on our legislative leaders, Amy Acton and our Department of Health, and our governor, Governor DeWine, to help guide us and start to set the principles for us to be able to make these decisions sometime in the next 6 to 8 weeks. It is unclear how long shelter in place will last, but most of us expect it to go until at least June 1st, if not well beyond. Many universities are already planning for virtual education to take place in the fall of 2020, if necessary. That's beginning roughly in August and moving forward. This is something that really is not going to be an opportunity for us to leverage the way other universities can, at least for our clinical year students. We've got to find a safe way to return them back to the clinical environment where they can work with patients, learn to actually care for patients hands-on, and prepare them to be the pharmacists and the physicians for our region and beyond. So we will be working very closely with our health systems partners to assure we get that into place, because we can't continue to practice the way we are now and ensure that we're producing the same level of clinically competent students to go off and become our healthcare professionals if we don't do this. So we are working diligently with them. I do want to share that the new medical school curriculum that is underway and being led by our Dean of the College of Medicine, as well as a large team of more than 20 passionate and actively engaged members of our faculty and administrative staff, is going very well. They held an open house with over 160 attendees this past week. The feedback was excellent. We continue to focus on the exceptional student experience while modernizing our curriculum to the benefit of our students, and then ultimately to the benefit of the patients that they will be caring for. I'd also like to recognize our Wasson Center. The Wasson Center has made changes to how we perform simulation as part of the educational measures in place to create great clinicians. And those recommended changes in the way we are doing things has also been recognized nationally. So Neomed is really standing out in the forefront in a couple of areas and getting outstanding recognition for the work that we're doing and the way we've responded so positively to the impact that's hit us because of the COVID-19 crisis. A big congratulations to our faculty members who are continuing to receive national grants, both federal grants and then also state level grants. And I like to call people out each time we meet to be able to recognize what they've been doing. And although in the past I've noted grants that we've received from the NIH and other federal bodies, I do want to recognize Elliot Reed, who's been leading our Ready Zone. He just received a $500,000 grant for Ready Zone. Really excited about that and the work that he's going to be able to accomplish to help push forward our entrepreneurship and commercialization activities at the university. I hope all of you are continuing to focus on your physical and your mental health. It is a difficult and stressful time. Being sequestered into a small place, not interacting with individuals, the improving but still gloomy weather and overcast skies that we deal with can make this even worse. So please communicate with family, communicate with friends, use the resources that are being provided online through Sequoia and other university programs to help get you engaged and to focus on both your mental and physical health and wellness is important. Remember, we are the walking whales, so safely get out there and continue to walk and get your exercise. Today's a lot less information to share. So with that, I wanted to stop there and give you an opportunity to ask questions of me.
First question, is there any update in if the campus will reopen to students and in-person classes after May 1st?
No, there is no update for reopening the campus after May 1st. We don't have a tentative date right now for reopening. We're waiting on the governor. And my suspicion is we're likely going to be around June 1st. I certainly hope it's sooner, and we will give everybody as much notice as absolutely possible. And I also suspect that the guidance we're going to get is not everybody's going to be allowed on immediately, that we're going to phase this in, and we're going to continue social distancing at work once we do have the clearance to get non-essential personnel back onto the campus. I'm anxious to get us back there, but only to be able to do so in a way that's going to be safe and not lead to putting you, your family members, or your friends at risk, or our community at risk. So we are waiting, just as you are, very much dependent upon the state and the state rules that'll be put on us.
Next question, under the CARES Act, Neomed received some money. Congressman Tim Ryan stated that half the money must go to students in the form of emergency cash grants. What's the plan to distribute this to the students, and where will the rest of the money go? Yeah,
and we are very, very closely monitoring that. I will tell you, I just got off a phone call where Dr. Rick Kasmer and also Maria Scheimer and Mary Taylor, who are three critical personnel who have been working on this at the university, noted that they've never seen a contract go through so rapidly to bring dollars into the university. And you're right, over 50% of those dollars do need to go to emergency funding for students. They are working out how we're going to do that now. And our expectation is more than 50% of it at Neomed will go to funding our students. We will provide more information on this for the students who this is going to impact very shortly, but those dollars are just coming in now. They haven't actually hit the door for us yet, but the contract went through very rapidly and was signed by the end of last week. So more information will follow.
This has been a very difficult time for junior faculty. Will the university stop the tenure clock so they can have more time to conduct their research?
Yeah, so this is something that all universities are discussing. What are we going to do, especially to protect our junior faculty who are on a clock? And for those of you who may not be aware, those faculty members who are under a tenure plan, meaning typically they have 7 years to achieve a level of academic success in order to become tenured faculty members who are now protected at the university because they've achieved a level of excellence in academia that we expect of a tenured faculty member. That clock is something they pay attention to and we monitor. Our current bylaws already have a clause in there that allows us to extend this as necessary, and we certainly know that any impact because of downtime from COVID-19 will be taken into account. We would never, ever hold any of this against our faculty members. We'll give you the benefit of the doubt. We'll continue to help you and to resource you. And rest assured that this time down will not impact your ability to make tenure because of a clock that's running. This has also been a key topic at the president's meeting at the Inter-University Council, and all universities have been coming together to ask this very question of each other. Some have said, what are you doing? What are you doing differently? And nearly the universal response has been, our policy already has this into place, that we are allowed to extend this because of extenuating circumstances. And so I don't think we're going to need to put anything additional into place. If for our junior faculty members out there, please understand that you can be comfortable that this will not be held against you.
Next question, has Neomed considered increasing instructional design support for faculty to have additional resources that help transition courses and assessments online?
So that's an interesting question. Have we, and that means I'm giving myself a moment to think about this. Are we doing anything different to help develop our faculty with online curriculum? And we've got resources that have been made available to help them get online very rapidly, but we haven't done as much because of the crisis mode we've been in with actually providing educational development for our faculty on how to do this better. And if we look like we're going to have to go into the long haul, once this semester's come to an end, which is really where our focus is right now, then we will have to get those resources into place. Many of the educational development programs that are being stood up around the new curriculum that we're introducing will be introducing those same principles because it's really media dependent. Media is a key player in how we do this. Students working together interactively, although they may be sitting in the same room, a lot of virtual interaction and virtual sharing with a larger classroom. So it's going to be key for us. I'm hoping that we're not in a position where we need to focus specifically on just virtual education principles to make our faculty great at that, because we'd really like to get back to having you on campus, keeping our students on campus. It's a better way to educate for what we do. I don't know that it's a better way to educate for undergraduate students, which could be a major change in the way business is done from here on for many of the undergraduate institutions. But if we look like we have to keep going, we will certainly put something into place. And if not, we'll ensure that a component of faculty development in education focuses on how to optimize utilization of multimedia and online technologies, in addition to how to be better in-classroom educators. We've got great educators. Our focus is always on making you better.
When employees return to campus, will leeway be given for them to get back into their routines? Will business continuity plans for each department be reviewed and or updated to accommodate for this type of shutdown?
Yeah, our business continuity plans are constantly being reviewed and updated now. I want to thank our leadership team who's been working on those for us. We are required to report those to the state. Um, we will certainly have latitude around that. We may be in a position where we're going to ask a number of individuals to continue to work from home for a while as we figure out what the phase-in plan is to get our staff and our faculty back on campus. And with that, maybe days where we have individuals come in periodically and then also work at home periodically. We just don't know what that's going to look like yet until we've received more guidance from the state on what the rules of engagement are going to be, so we can create standard operating procedures with latitude and understanding that many of us may be in a position of coming back or being asked to come back at a time where the rest of the community isn't. So for those of you who are parents who have no caregivers at home for your children who are out because of school, and there may not be summer camps and there may not be daycare yet in place, if those are some of the last items to be put back into place in our community, we certainly understand that you have family first, and you need to be able to take care of your family. Your job helps you do that, provides the financing, but we need to be able to work together. Really, we all live on that three-legged stool of work, family, and then attendance to our own personal health and wellness. And those three things have to come together to keep us whole. And we will certainly keep that as part of our focus as we decide how we're going to do this moving forward. In short, we just don't know how it's going to look yet.
How can students best support NeoMed, particularly preclinical students who may have a few extra hours a day? Can we help our professors or leadership?
That's a wonderful question, and I want to thank you for the offer. Our students right now, we really want your focus. Right now, we need your focus to be on excelling in your curriculum, learning the material so that you can apply it to research and to patient care. And when the semester comes to an end, there may be more formal opportunities before the new semesters start for you to get involved. I realize you typically look to do other things between semesters, to go places, to have rich experiences in life, things that may not be there for you now as we have travel restrictions. And so we may be reaching out with opportunities. Right now, we had a concerted effort around this and decided that we did not want to burden our students with additional responsibilities that were created by the university as a whole. And so we've not asked that of you. You are certainly welcome to get involved on one-offs. If you have faculty members you want to work with, if you'd like to get involved with some type of research online and starting to get projects in place so that you can do them actively when you come back, that's a good use of your time now. But our number one goal is not to burden you with additional efforts while you're transitioning to virtual education and trying to learn the material to make you successful for progression into your next year and to graduation.
Is there an update on the personnel positive or negative for the virus who are quarantined because they were exposed to an employee who was diagnosed with COVID-19?
The update I received from Michelle Galwan and also from our medical director, Dr. Joe Zarconi, are that those individuals are doing well and have come off quarantine, come off isolation, I guess would be the better term. Quarantine is typically for people who we don't know have a disease, and isolation are for those individuals who do. So right now, the briefing I received, last information was that everybody's doing well and they are now off isolation. That does not include our student who was recently diagnosed, who is, I'm told, doing well from a physical health standpoint, but is currently still in isolation.
Maybe a premature question, but if a non-essential employee does not feel safe coming back to work once phase 1 begins, will there be any repercussions?
So that's something that we're going to have to spend time reviewing and understanding. I know there's going to be a lot of individual stories that we need to look at. Certainly, if we have somebody coming back under phased in efforts, and if you're targeted in an early phase to come back, but we know there's still a risk, that's the reason we're phasing it, of virus transmission. And you either yourself are in a high risk category or you live with somebody who is in a high risk category, we are going to do what we need to do to make sure that you can continue to still work virtually until we've been able to mitigate that risk as much as possible. So again, we're going to look out for our community. We've continued to run this university and run this university very well with most, really 95+% of our faculty and our staff working from home. For those of you who've adopted to it, we're working long hours. We're doing it virtually. You have less downtime as you're sitting in place, going from one meeting to another meeting, while also trying to get work done to send out by email and answer phone calls. But we've been good at this. So there's no reason to put our members at risk. If there are extenuating circumstances that can have them not to come back, at least in the short term, and in the long term, we'll have to look at individual cases based on policy. Once we're back to really a baseline and the governor's office saying it's safe for everybody to be back at work again and to start to get back to business as usual, then at that time, we're going to expect members to be back on campus and working. And that's really going to be based on the best community healthcare information that we have. And all of you know, when it comes to the health of this state, we've got a very conservative governor and director of Department of Health who's going to look after your welfare first and foremost, and is going to be a little bit slower, I suspect, than others in getting us back.
The final question that we have for today is, we emailed Michelle Gowon about the blood drive for May 14th. Should that be canceled, or is that able to continue?
So I'll talk to Michelle about this. You know, most would consider the blood drive to be still very much a critically essential component of our healthcare system. We know nationally and regionally, blood donation is down substantially because of the COVID-19 crisis. But people are still having traumas. People are still coming into the hospitals requiring blood transfusions. Some COVID-19 patients are requiring blood transfusions. We know that patients who are in septic shock, which many of the COVID-19 patients who are in the ICU are, somewhere between 20 and 40% will require a blood transfusion. So I am here to support, as you are, to support our health system and the health of our community. And if we can do it safely, we will continue to have those blood drives. We actually held a blood drive during the shelter-in-place period already. I'm certain we had a limited number of participants, but we did run it, and I did see people on the gurneys outside of the area of Watanakunakorn laying down, donating their blood and really being outstanding members of our community. Right? I mean, that takes a lot to come out at a time like this and to then lay down, get a needle put into you, and give blood so that you can really just look after the health and welfare of other people in our region. So I applaud those, and we'll do everything we can to make sure that stays in place. Again, thank you all for your time today. Stay safe, stay healthy. We'll continue these updates every Monday. And I'm hoping that sometime in the very near future, we can all get back together again on campus, be able to get this behind us, and celebrate as a university all of our accomplishments during this time, and then move forward for a great future. Thank you.